on our website, bbcnews.com. A radical new immune therapy developed from cases of what have been called miraculous cancer recoveries could be tested on patients as early as next year. Scientists have found a way to screen potent cancer-killing immune cells from donor blood and multiply them by the million. Let's talk to someone who knows more about this stuff, and his name is Alex Blyth. He's the chief executive of LIfT BioSciences. Thank you for joining us. How will this therapy work?
Well, it's still very early days, but the therapy works by essentially taking the innate immunity that certain fortunate individuals have and transferring that to patients who are less fortunate.
Right, and you must be fairly confident of its efficacy if you are getting close to testing it on patients then.
Well, we've had, historically work done in vivo on mice, and there's been that's shown to be curative in things like soft tissue sarcoma, and then in vitro it's been tested in how it can kill cancer cells on a whole range of different solid tumours, from pancreatic, cervical, prostate. So
you're basically saying that it's going to work. Are you focusing on a number of cancers?
No, we're not saying it's going to, sorry, we obviously it needs to go through testing so it's going to work, but we are very optimistic about the results we're seeing.
Again, many cancers, and you've mentioned some of them there. Is there one that you're particularly interested in?
Well, pancreatic cancer is something very close to my heart personally. My mother died of that 3 years ago. It's also arguably the highest unmet need cancer in the area, and that's a number one priority for us, alongside some other high unmet need cancers that we have lined up. And our mission is to have a curative therapy clinical trials by 2021.
You say it's going to be curative as opposed to therapy that just manages cancer. Is that right?
Our mission is to find something curative, and that's what we set about at the beginning, and that's still our mission. Obviously, a lot more work needs to be done before we can demonstrate that. But we have deliberately taken a very different approach to tackling cancer in order that we could find something curative.
Right. Just tell us a bit about that approach again. Just explain it to us like we were pedestrians walking on the street. How exactly would it work?
So in the population, people have differing levels of an innate immunity against certain cancers. So some of us are fortunate enough that if a tumoring cell starts to develop within the body, actually our innate immune system, which is the first line of defense, will go and destroy those early mutating cells before they become a concerning tumor, where others in the population are less fortunate. And actually, as those cells develop, the innate immune system is blind to them and not able to stop them. And the adaptive immune system fails as well, and they develop cancer. And what we're essentially doing is saying, for those people where their own system is failing them, we can take the immune cells from somebody who is effectively killing cancer cells in their own body, potentially every day, and put those into a patient.
Alex Blyth, how do you find the patients who are, in a sense, cancer resistant?
Well, it's a very good question. It isn't as simple as finding people who've had spontaneous regression, which some of the headlines have suggested. It's the approach comes from the thinking behind that. But actually, there are some studies suggesting that it's the younger age group, say 18 to 25-year-olds, particularly males, who are most likely to have this very high cancer resistance, no family history of cancer, a few other indicators, but we actually have our own special technology and a special assay for testing the cancer-killing activity of people's innate immune cells in their blood, and we just take a small amount of their blood to test this.
Okay, but I'm asking whether you find them randomly, people sign up, how exactly does it work? Do you find the individuals?
Well, there's two ways you can go about this. At the moment, we can test off the blood banks, what blood banks don't use, which is essentially the white blood cells, which we do use. The other way is that we would invite donors to take part in our trial, and we're hoping to do that to the end of next year, invite those donors forward, and then with a view to this being taken into patients after that.
Okay, that makes sense. Thank you very much. That's Alex Blyth of LIfT BioSciences.